Psychological disorders. Any pattern of behavior that causes people significant distress, causes them to harm others, or harms their ability to function in daily life. Comorbidity is the occurrence of two or more disorders at the same time. Disturbance of thought, emotion, or behavior, dysfunction of biological or development process, distressing in everyday life. DSM-5. In a given year, about 26.2% of American adults over the age 18 suffer from a psychological disorder. The pros are they provide a common language to professionals. They establish distinct categories of diagnosis for treatment and understanding. The cons are their overly prejudicial and psychology student syndrome. Culture influences how disorders are diagnosed. Schizophrenia. Psychotic disorders, inability to distinguish between real and imagined perceptions. Schizophrenia is disordered thinking, bizarre behavior, hallucinations, and an inability to distinguish between fantasy and reality. Positive symptoms, excesses of behavior or occur in addition to normal behavior, hallucinations, delusions, and distorted thinking. Negative symptoms, less than normal behavior or an absence of normal behavior, poor attention, flat affect, and poor speech production. Catatonia. A typical onset of schizophrenia in early adult years correlates with poorly myelinated and thus inefficient connections between cells in the frontal lobe, small hippocampus, and enlarged vesicles. There is an identified gene variant that reduces dopamine activity in the prefrontal cortex. Mood disorders. Depressive disorders. Major depressive disorder is pervasive low mood, lack of motivation, low energy, and feelings of worthlessness and guilt that last for at least 2 weeks. Symptoms of major depression: little or no pleasure in any activities, lethargy, sleep disturbances, changes in appetite and weight, excessive feelings of worthlessness and guilt, trouble with concentration, suicidal ideation, and hallucinations. Major depression in gender. Most common types of mood disorder, 3 times more common in women, and 3 times more common in 18 to 19-year-olds and 60-plus-year-olds. Bipolar disorder. Substantial mood fluctuation cycle between major depressive episodes and maniac episodes. Maniac episodes are increased energy, sleeplessness, euphoria, irritability, delusions, increased sex drive, and racing thoughts. Maniac episodes can last for a few weeks, or a few months. Cyclomythia, relatively mild but long-lasting form of bipolar disorder.